And good morning, ladies and gentlemen. Today we present to you the September episode of Aap Ki Sehat.
Hello everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary General of IMA Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Hello listeners, welcome back again to the Aap Ki Sehat, meaning your health program of the Indian Medical Association of Queensland. Today we have the listening pleasure of talking to General Practitioner Dr. Abha Chikarsal. Dr. Abha is a fellow of the Royal Australian College of General Practitioners and has wide experience in the knowledge of general practice primary care. As we know, the primary care is the cornerstone of health, gatekeepers of general, healthcare to the people. So, Dr. Abha, Remya has already told about the public health message from the Indian Medical Association to our viewers. Our viewers would like to listen to know more about your educational background. So please highlight on those things, Dr. Abha.
Thank you for having me, Dr. Cyril. I am a primary care physician, a general practitioner, currently practicing in Brisbane. I have migrated from India to Australia 15 years back, and it has been an amazing journey of these 15 years. It has just gone very quick. I started my work in Victoria, and that's where I trained. I completed my FRA CGP degree, my fellowship in Victoria, and since then I've worked in various settings, including metropolitan hospitals in Melbourne, country hospitals or the urgent care centres, primary care, general practice clinics, aged care, and now I'm working in a skin cancer clinic as well. So
that's good to know that you have wide experience in different parts of Australia. So the viewers would like to, we know that general practice and most women doctors, or the patients like to go to the female doctor for women's health, contraception, cervical screening test, and other health conditions. So can you highlight on general practice as such, and then some details on women's health as well, please, Dr. Abha?
Yes. So women's health comes naturally to me. So I felt a need to upskill in this very important area of general practice. I have upskilled in women's health, have completed national certificate course in reproductive and sexual health under the Family Planning Alliance Australia, and I've completed IUD training. So I am able to provide all these services in general practice to women. I've also completed various courses in skin cancer medicine, and I'm currently working in a skin cancer clinic as well. So I'm providing contraceptive care needs to women, preconception counseling, pregnancy-related care, mental health support to women, and menopause management. So basically covering women through all their life, from a young age when they're growing up to menopause, after that when they're aging.
That's good. So viewers, we have Dr. Abha Chikarsal in the first episode today, highlighting on the general practice issues and general women's health. In the second part, once we finish this talk in the next episode, we will ask Abha to highlight more on the different age groups of women, girls, and so on. So we know that some GPs tend to have a special interest towards something. I know that as a GP you will be involved in immunizations of children, other chronic disease conditions. So can you highlight on the general practice briefly, please? on general practice as such, different medical conditions that you encounter and treat for the viewers' information.
Yes.
Thank you.
So in general practice, as the name suggests, we look at a wide range of medical conditions, managing people, helping them, as we say, from cradle to grave. So I manage children with their preventive health in children, including immunization, their regular checks at the designated age groups, and just when their mums come with their children, just looking after the mother's well-being as well. And then we look at their other healthcare needs, their general healthcare needs, apart from the women's health issues as well, their mental health.
Preconception as well. Suppose couple, they come, they want to get pregnant, a woman, those things as well.
Yeah. Preconception counseling and pregnancy-related care is an important part of my general practice consultations. In fact, I am a part of, I'm a participant in an Australian government-funded initiative, research study, which is called Mackenzie's Mission. And in that research, we are helping couples who want to check their genetic carrier status. They can enroll in the study and find out whether when they get pregnant, is there a chance that the baby can be affected by certain genetic disorders. So that's a research study which is currently going on. I also advise women about reproductive plan, which is a new concept these days. As women are delaying conception for various reasons, they need to know, just like how they plan other things like travel, their careers, their home, a mortgage. This is also something that they need to plan.
Yeah. Rightly said. Nowadays, we see that the young couples are more busy with starting their life, their career, and they tend to postpone the pregnancy and things. So, as you said, even before getting pregnant, the preconception is important. Can you give some advice towards on the duration of the pregnancy? What would you like to tell our viewers, please? Thank you. Like nutrition, whatever, yeah.
Yes. So preconception, first of all, I advise women to track their cycles. If they are regular, then we can reasonably predict their fertile time. If they are irregular, I advise them to consult me, and then we can look at what are the reasons for irregular periods. Nutrition is very important. Approximately 3 months before getting pregnant, it's important to be on folic acid and iodine. So need to be on some prenatal supplements, avoiding alcohol, no smoking. Also, again, as I mentioned before, there's an option of the genetic carrier screening, which is ideally done in the preconception time. And as per the Mackenzie's Mission.
Any routine blood tests you will be asking them to do if they come for a preconceptual counseling, like thyroid and sugar and things,
Yes.
Yeah.
We tend to check their rubella status, their thyroid, hemoglobin, check their iron levels, particularly for women who are vegetarians or whose nutrition isn't the best. So these are the things we tend to do. Make sure their pap smear is up to date, check their family history, if there's any significant history in the family that has a bearing on the pregnancy. So all of these things are very important. Also checking the woman's mental health, what their social scenario is, and whether she has various social supports in place. So all of these things are very important to plan and determine in the preconception time.
That's good to know. Look, some couples, in spite of this, they tend not to get pregnant. So infertility is a growing issue. Can you highlight on that?
Yes. So in terms of, as I mentioned, the reproductive plan, it's very important for couples to plan it such that they don't miss the boat, so to say. And also there is fertility preservation options which are available. So those are all the things which my patients need to know about while they're going through this journey towards parenthood. So those are all the things I discuss with them.
Some youngsters, they're too young. We don't want like unplanned pregnancies. What contraception options would you advise to these young future moms?
So these days, we know that younger women, by virtue of their age, have the highest fertility. So we need more reliable contraception for them. So we're moving towards LARCs, long-acting reversible contraceptive methods, which includes intrauterine contraceptive device, hormone implant, the depot hormone injection, which are so-called fit and forget methods. And these methods are really good for younger women with busier lifestyles, where they can simply have that placed, have that fitted in, and fit and forget, and move on with their lives.
What's your view on the implant? The youngers call it as bar. My friend has a bar.
Yes.
Can you insert a bar? Please say something on that.
So the bar or the implant is one of the most effective contraceptive methods. It's more than 99% effective. And 1/5 of women who have implant inserted do get some troublesome irregular spotting, but 4/5 of women still have manageable periods in one way or the other. So it's a highly reliable contraceptive method, and when it's time for them to get it removed, the fertility returns fairly quickly. So it's a really good contraceptive method.
For 3 years.
For 3 years.
Remember to take the
To
pill every day.
take the pill. And the IUD device is also having a very high uptake in younger women. And what's changed from maybe 10 years back is that it's being taken up by women who've never had children. Previously, we used to think that IUD is only for women who've had children before. But now, a lot of women are taking it up before they've ever had a child.
So, finally, what take-home message would you like to give our viewers on the general practice, especially women's health, Dr. Abha?
So, my advice to the listeners of this program is that prevention is better than cure, and healthy lifestyle, the two most important pillars of healthy lifestyle is good nutrition and exercise, and maintaining a normal BMI and a healthy basic exercise regime and a food regime.
That's a lot of good advice you have given our listeners. Thank you, Dr. Abha. On behalf of the Indian Medical Association of Queensland, we are very glad that you came into this Aap Ki Sehat program. We'll see you back again in the part 2 of this section, in which our viewers will benefit from more information from Dr. Abha's wide experience. Thank you, Dr. Abha.
Thank you for having me.
And ladies and gentlemen, that has been the September episode of Aap Ki Sehat presented by the Indian Medical Association of Queensland. And as Dr. Cyril Fernandez mentioned, that is part 1. And next month we'll bring to you part 2. So it's been wonderful having your company on this special episode of Aap Ki Sehat. We'll see you in the next episode. Until then, it's goodbye from me.